Post-traumatic stress disorder, also known as PTSD, represents a significant public health challenge. Traditional treatments leaves a substantial of patients with residual symptoms or they face treatment-resistant outcomes. Non-invasive brain stimulation, or NIBS techniques, are emerging as an alternative approach for treating PTSD. Today we'll review current evidence of the NIBS technique effectiveness as treatment for PTSD, as well as examine the mechanisms and acknowledge its limitations and future directions based on peer-reviewed research. PTSD is characterized by intrusive memories, avoidance behavior, negative changes of cognitive and mood, and alterations in arousal and following reactivity of exposure to traumatic events. The disorder involves dysregulation of neural circuits connecting to the prefrontal cortex, amygdala, and hippocampus. The basis of understanding the neurobiological mechanisms allows grounds for possible target brain stimulation interventions. NIBS is a non-invasive medical procedure that uses magnetic pulses to stimulate nerve cells to improve overall symptoms of abnormal conditions. The magnetic energy induces small electrical currents that changes the brain's electrical activity and chemistry. Repetitive transcranial magnetic stimulation, or RTMS, is one of the many techniques of brain stimulation used for treatment. RTMS has been represented as the most extensively studied and successful outcomes of an NIBS treating for PTSD. The RTMS targets dorsolateral prefrontal cortex, or DLPCF, in the right hemisphere. The electric currents aims to adjust the prefrontal amygdala circuits. The high frequency is delivered over multiple sessions. Now that we have a basic understanding of RTMS and PTSD, how does the RTMS work in treating the pathologies of PTSD? There are three areas that the intervention targets, which are key to neutral circuits that are assumed to be related in trauma-related pathology. The neural circuit modulation involves targeting the prefrontal amygdala circuits with RTMS precision to the DLPFC. It enhances regulation of the amygdala and improves the fear extension through the learning and emotional regulation, and restores the prefrontal control over limbic hyperactivation. Changes in the default mode network includes adjustments to the intrinsic connectivity of networks, leading to reduction in trauma-related rumination and intrusive thoughts, along in improving cognitive flexibility and attention regulation. The dysregulation of PTSD in neuroplasticity causes memory and learning issues, emotional regulation difficulties, and overreactive amygdala, leading to impacting brain-deprived neurotrophic factor, or as BDNF, for neural growth and connection. The use of RTMS reduces these effects through long-term outcomes of potentiation, provides regulation for neurotransmitter systems, increases the BDNF expression, and assists in fear memory reconsolidation process, which is crucial in the process of reducing PTSD symptoms. The RTMS-specific targeting area for alterations on the cortical excitability has received significant recognition as possible treatment on PTSD. However, how realistic is the effectiveness of treatment when applied? A comprehensive meta-analysis review have examined the treatment for PTSD. It has reported that overall symptoms significantly improved through the comparison of the active stimulation to sham conditions. With large pooled effect sizes, it had shown the benefits of the post-treatment that was maintained at 2 to 4 weeks, including follow-up assessments. Further evidence is shown in a recent network meta-analysis of randomized control trials that identified the specific protocols to have superior efficacy. The high frequency of the RTMS, specific targeting of the area, demonstrated the largest reduction in PTSD severity, with associated anxiety and depressive symptoms. Studies have suggested that the post-treatment effects can last between weeks to months. However, long-term examinations are needed for establishing the sustained efficacy. Other studies have also supported the safety of the procedure across trials with minimal adverse side effects. The current evidence show positive evaluations in the use of rTMS for PTSD with the consistent results. It also acknowledges that as evidence are emerging, there are limitations that create barriers in utilizing the full potential and efficacy of rTMS for treating PTSD. Other studies have also addressed these limitations and the challenges that may occur, highlighting the need of considerations to take place. The current methodological use of the rTMS often uses small samples, creating difficulties across trials and maintaining effectiveness. The population heterogeneity causes varying conditions and factors that affect the responsiveness to treatment. Technical challenges rises in the facing of anatomical variability and the need for more technological guidance in understanding the dose-response relationship and standardized challenges of expertise and equipment across clinical trials. With these limitations in mind, future research needs to consider on advancing methodologies through larger scales and use precision medical approaches. There's also the need to take advantage of the technical innovations of advanced stimulation techniques and combine them with other interventions such as psychotherapy to maximize the effectiveness of treatment. Mechanistic understanding is essential through neurobiological research of the abnormalities' functions, along with the clinical phenotyping to determine the best treatment strategies. Further clinical considerations involve the treatment selection based on the patient's factors and clinical infrastructure that will impact the outcomes of the treatment. The rTMS technique for treating PTSD has great support through growing evidence of its efficacy. The technique shows the normalizing of dysfunctional neurocircuits with excellent safety profiles of minimal adverse effects. The high-frequency stimulation with specific targeting demonstrates the strongest evidence base of the treatment. Limitations of the current state showcases what developments can be done to maximize the best and appropriate use of rTMS. Future directions highlights factors to consider as key priority research and showcases the potential of using rTMS as a forefront treatment with credibility and sustainable outcomes.